Welcome to Derm-It Trotter, Don't Swear About Skincare, where host Dr. Shannon C. Trotter, a board-certified dermatologist, sits down with fellow dermatologists and skincare experts to separate fact from fiction and simplify skincare. Let's get started.
Welcome to the Derm-It Trotter, Don't Swear About Skincare podcast. Today we have Dr. Ronda Farah, Associate Professor of Dermatology at the University of Minnesota, and she's also opening her own practice here soon, Illuma Dermatology in Minneapolis. Her area of expertise is hair loss, and I know a lot of you out there, you've experienced hair loss at some point in your life, and we all know the emotional toll it can take on us. So I'm so excited to have Dr. Farah here today to talk more about treatment and really give a lot of you hope out there. So welcome to the podcast, Dr. Farah.
Thank you so much for having me. I'm very excited to participate.
Well, it's a pleasure to meet you and have you on today because I know I've kind of looked at some of your lectures and you've talked a lot about hair loss and the treatments because I think that's what a lot of people come in. They're like, I know I have hair loss, but how are you going to fix this? And, of course, a lot of people probably already tried or heard of minoxidil or Rogaine, which you can do topically or even orally, of course. But I wanted to touch upon, for that just real briefly, because I know we want to talk about other treatments. When do you recommend, doing over-the-counter Rogaine? And, do you really talk people through, they read about it causes hair loss, and how do you really kind of deal with that so that patients can accept that maybe that is a good part of treatment? Because a lot of people think it's bunk.
Yeah, this is a great topic. So minoxidil, and then the brand name being Rogaine, has been, a dermatology favorite for years. It's something that has been FDA approved to grow hair. It's topical. It's available over the counter. As a dermatologist, I would say if somebody's losing hair, of course, diagnosis is always the most important. So what you and I are about to go through is medical information, not medical advice, but just kind of gives the community access to some information to consider when they go in to see their dermatologist or their doctor. So one thing that dermatologists really like about minoxidil, also known as Rogaine, is it is a topical. So we're not having to take it internally by mouth, and patients can typically buy it over the counter. One of our favorite things is it has some actual clinical studies demonstrating an increase in the thickness of the hair and the amount of hair coming out on the scalp. And that's been repeated over and over in dermatology. So that's why you see that long lasting sort of alliance to minoxidil by many board certified dermatologists.
And, I think for, hair loss, I forgot to kind of mention, it's such a broad, thing to cover, alopecia, medical term for hair loss. And, today what I really want to dive in is sort of that thinning that we all get that happens sort of over time, what people will call androgenetic, type hair loss or female or male thinning. And so Rogaine, as you mentioned, or minoxidil, often offered as an option for treatment. Beyond topical, there's been this new trend to talk about offering it orally. Do you feel like there are advantages, to doing that, or something you do recommend to patients? And when do you do oral versus a topical?
Oh, those are such good questions. So I love topical minoxidil and oral minoxidil. And oral minoxidil has really surged in the last 2 to 3 years in the US in dermatology. I really like how you were just talking about generally minoxidil topical or oral. Most dermatologists are using that for androgenetic alopecia. Now, the oral version is not, I don't think it's currently based on today's date at this moment FDA approved for treatment of hair loss, but dermatologists use it in a way we call it like off label to treat hair loss, which we do with many, many, many medications. One thing about topical minoxidil is I have my patients apply it nightly, use it for 3 to 4 months until hair slowly grows in. It almost looks like grass growing in, little tiny baby hairs, and then go to 6 months and then a year. But that's a lot of work. And it can be a little flaky or itchy or red. Some people can get allergic to it, especially the topical solution contains some alcohol in it and something called propylene glycol, which dermatologists know can sometimes be a bit irritating. And I've used minoxidil topically, Rogaine topically myself, and I've also experienced that. So one thing that we saw, in the New York Times was that surge or that article of an old pill with a new use. And so minoxidil was initially FDA approved for high blood pressure. And so doctors used to use it for high blood pressure, usually at higher doses. And they knew that patients could get hairy on it. And then we saw internationally in the last few years, many, many dermatologists using it internationally for hair growth at lower microdoses with good success. So we kind of saw that trend unfold into the United States, hitting the New York Times, and then prescriptions for oral minoxidil surging. In the dermatology world, I'd say in general, using small doses of minoxidil is really important because sometimes when we're taking it by mouth, we can get a little hairy on the face, chest, or back, which may or may not be something that our patient is looking for. So the dermatologist will typically go through, that. And there's some other cardiac, like boxed warnings on it. For I would say over 90% of my patients, the boxed warnings, the heart warnings, and whatnot are on there, like not really relevant. And I've had really good success with that drug, but every patient needs to see their doctor to decide if it's a drug that's safe for them, if it can be combined with their other medications, and if they'll have a problem with it. But it's been a huge help for androgenetic alopecia in my patient population.
And before we go on to other, treatment options, the one thing I want to get your comments on, because this is probably something I hear from patients all the time, like I'm not going to, do minoxidil or Rogaine. I read on the label, it causes hair loss. And so do you mind just commenting on that briefly? Because I feel like that's sort of a, to get patients over that hump and trying to explain to them, we're not going to recommend something to you that we actually think is going to make your hair loss worse. Like, how do you handle that for them?
Yeah, hair is really tricky. So, as you know, as a dermatologist, the hair has 3 cycles: the growth phase, the resting phase, and then the shedding phase. And I would say most dermatologists in their clinical experience know that if you quickly stimulate hair growth, you're going to get movement of many of those hairs into shedding so that you can then sustain the new growth phase. That's just a way to explain it. It's almost like you're going to shed the hair that's like not going to cut it and you're going to hold some hair longer in the growth phase. So I usually tell my patients that they may experience some shed with the topical or the oral medication. I typically personally will see it between 4 and 8 weeks. 3 months is starting to get a little long, but I'll still monitor it. They may experience shedding, but I personally have never seen anyone where that's a persistent issue that they were not able to overcome. And then over time, going into months 3, 4, 6, or even a year, we see hair growing in more and more and more and more, and then those sustaining for longer periods of time. And then the hairs themselves are typically thicker. That means like wider in diameter, making the scalp appear more full. So it is one of those things where a small percent of patients might experience a shed, but we see that with other things. We see that with topical minoxidil. I see that with, the low level laser lights or photobiomodulation lasers that capture stuff you see over the counter. So it's kind of like sometimes there's this like a little bit of setback before you have the growth. But I will tell if they call me and they're really worried about it, I always have a little threshold to bring that person back in. Let's make sure we haven't missed something because hair loss is extremely complicated. Even the best dermatologist could think, oh, this is just regular old thinning. And then as time evolves over the first year, the second year, or months, or with treatment, it's not responding the way we thought it would. And those instances, the dermatologist can do more labs. They can take a biopsy. They can get a second opinion. They can do dermoscopy. They can do hair counts. They have all these tools that can help them refocus on, is this the right diagnosis? Are we missing something else?
So if I've already come in, maybe I'm experiencing hair loss and kind of, we've talked about, I've, tried some topical Rogaine. Maybe we're talking about shifting me to oral because I just can't keep up with it. It's too much maintenance for me. And I've also admitted to you, hey, I've also been taking some biotin, or I've been thinking about other supplements, just to add into my hair loss routine. What would you say to somebody like myself? Like, what's the evidence for that? Or do you feel like there's a strong, set of data that really says, yes, you should definitely do this supplement or this much? Because I think a lot of people are looking for that natural alternative or something else they can add in. And often, like me, the example, they might have even tried it before they set foot in your office. So how do you respond to that type of question?
Yes, so I would say that's something that just really makes me excited. Like I'd say about 5 or 6 years ago, I got really excited about what I call hairceuticals, which are basically, those things you find in the supplement aisle. Those aren't things that the FDA is regulating like closely. They're not monitoring exactly what's going in there and whatnot. So I always, when I see my patient, I will ask them, like, what is your diet like? What are your medical problems? What symptoms are you having? And then as a physician, we're able to get those laboratory tests. I might test their iron, I might test their hormones, I might test their vitamin D, I might look at their zinc, depending on what their medical history is, and other lab work also. And then I will typically adjust the nutrients. So if I'm seeing a low zinc, if I'm seeing a low vitamin D, if I'm seeing the patient's anemic, then I'll either replace or try to figure out if there's a medical reason for that. And that's the way I personally am the most comfortable. I will say I am excited in general for that hairceutical market to continue to grow. I think it is important that we have options that are, as clean and natural as possible. The thing about these things that are available is they are just not that heavily regulated. One good example is biotin. We had that FDA statement regarding high dose biotin, and patients taking high dose biotin and then having issues with their heart, going to the emergency room, and then that high dose biotin making it hard for those doctors in the emergency room to figure out that the patient's having a heart attack because the supplement is interfering with those lab tests. And so if you just Google FDA biotin, you'll find that was when I first really got interested in that area, because I'm like, wow, every patient's taking biotin for their hair. What is the evidence behind biotin? So if you look up Farah, like one R, Farah, kind of like Farrah Fawcett, but one R, and biotin, you'll see my publication on biotin. So immediately after that, we wrote into the Journal of the American Academy of Dermatology. We did an article reviewing biotin, and at that time point, I think you'll have to look at the article. It may be dated 2018, 2019. It was around that time just before COVID, but there was no good evidence really for biotin for hair growth, unless in the literature, the patient had a biotinidase, like a deficiency, like a medical disease, basically making it hard for them to, keep their biotin level normal. So after that, I was like, wow, all these things over the counter say biotin for hair, but when you look in the medical literature, there's not really support for that. And I think that idea may have come from some of the nail literature, which nail is keratin and hair is keratin. I don't know if that was extrapolated. But so I personally, when I see patients on biotin, I have them, look at the dosing, make sure it's not ultra high dosing. And I know I don't want to comment on the dosing levels. I will say you can look up what the FDA has stated on their site. 3,000 micrograms, I start to, just for sure take a look at that. But then discussing with your doctor where you think that upper limit should be, because really high doses can affect your labs and probably are not really super helpful for hair. And we can get biotin from things like an egg. So biotin was the first time I was like, oh, what else is in these? And then I would flip them around. Oh, vitamin A. And then I go to the literature. Vitamin A actually in the dermatology world, if it's too high dose, can actually result in hair loss. And a lot of these supplements have more vitamin A than the daily value. And then selenium, if you get high doses of selenium, many of them contain selenium, you can get, that could be an issue for you in your hair also. And so in that article, basically I made a table and it lists all the things that, I sort of found in many of these supplements that I didn't feel like had, a lot of good evidence behind them. And so, and then there's a second article if people are interested. It's Farah and it's hairceuticals. If you just look up hairceuticals in Farah, and it kind of shows you social media trends and some issues with what's going on there. So long story short, then in the last year, there was a really nice publication in the dermatology world talking about supplements and what evidence there is for them. And it was an outstanding systematic review, which in the medical world means these authors did a great job looking at all the literature, and they concluded these might have a role. But the problem is many of these supplements that our patients sign up for and are paying these memberships for, the studies are done by the companies, right? So it's really hard to sort of like sort that out. Like more independent research and more replication of data is needed. So for me to tell a patient to pay for a consistent subscription of a supplement all the time, and these are expensive things, and I don't see a deficiency or an issue like directly on their scalp or hair shaft disorder that I know would benefit for that, that's really hard for me. So I typically stick with, getting my patient's history, their diet, and testing them and going with the evidence that I see and walking them through that so that we can sort of, make a joint decision on what is the best for them.
No, I think that's really important because, the natural alternatives, I think there's a great need, there's a great demand for that, for the public. And a lot of people listening are looking for those options. And there's a little bit of, like you commented on, sort of this assumption of safety and not understanding that supplements, they're not regulated by the FDA the same way, our prescription drugs have to undergo that, rigorous testing to really prove that they work. And I think that's something for the public to be aware of. And definitely what you just said, about the biotin thing, I literally think mind's blown. Like people will hear that because that is just something everyone seems to do. It's marketed that way, to people. They go into the grocery store or their favorite supplement store and they see biotin, it's hair, it's nails, it's going to give you that growth back. And you're right, without that data really being there, it's hard for us to strongly recommend it. Some of my patients will say, can it really hurt? And I said, well, potentially, especially biotin, as you mentioned, the lab abnormalities with the cardiac enzymes or heart enzymes that they're potentially having a heart attack, or potentially, thyroid labs, as we know, can also be affected. So I think it's really important that people are cautious about that, and really talk with their doctor before doing that, because just because it's over the counter and accessible doesn't mean it's necessarily a good idea, not only for your health, but is it truly going to make a difference? Like you mentioned, for hair growth, kind of along the lines of the supplements that you just touched, kind of talked about too. I sort of want to shift gears as we're talking about kind of these other sort of less known treatments for dealing with hair loss. And you mentioned this a little bit earlier about light devices. I think this is something too, people are trying to figure out, is there really data to support this? And there's some that are FDA approved. There's some people can buy and actually integrate in at home, or even, I've seen at some of the salons or even physician offices, people can get light or laser treatment for hair loss, especially, age-related hair thinning. What do you think about those? And what does the data suggest to you if they're really useful?
Yeah, so I am a fan of we call it low-level laser light, low-level light, these combs and helmets. The ones in the United States have been FDA cleared since the first comb in 2007. I do think they did appropriate studies. And in the hair world, so within the dermatology world, for everyone listening, there's all these hair people that are very focused on hair world, and they have standards, these hair dermatologists, and they like to see the number of hairs counted on the scalp go up. They like to see the images at a certain quality. They like board certified dermatologists on board who have hair clinics and are experts in hair loss, and they like the study replicated at multiple sites. And of course, we like FDA clearance. So I think these devices, they're not magic, but I think they have good data that they can be helpful for hair growth in that androgenetic alopecia setting, for many, many, many patients. So you can get some things like and again, this is medical information, not personal medical advice. So when you're talking to your dermatologist in general, ask them like, is this a good fit for me? I mean, it's not a drug. If someone's looking for not a drug, if they're looking for something they can, do, while they're doing something else, they can use a helmet or a cap. The combs you typically have to hold, so those are typically a little bit cheaper because the number of diodes or laser parts to them is less, but you have to hold them to treat. But I do think they're low risk devices. And then going back in all these treatments we talked about, like as a women physician, I always like to also just, we have pregnant women out there, always say each of these things has not necessarily been studied in pregnant women. So those are discussions to have also specifically with physicians. So I'm a fan, basically. I like them. I use them all the time, but they take longer in my experience, 6 months or more to see improvement.
That's what I was just going to ask, if you kind of give a time frame, because I think that's the hardest part. People lose hair very quickly, but the regrowth process, even when we intervene, always tends to be slow and not very satisfactory. I know to people, very frustrating to just watch it fall out at such a rapid rate. And some of that's been gradual, but for a lot of people, they appreciate it being a faster process, but then getting it back takes forever. So 6 months is kind of what you recommend doing it with. And do you do that as a part of a whole complete treatment regimen that you give to a patient, or do you ever recommend it as sort of therapy just by itself?
I mean, every patient is different. I mean, I have patients on, you know, 3 hair loss oral medications and a topical and a helmet. Like, that patient wants their hair. They want every hair. They've even had a hair transplant. And I have patients that are like, I need drug-free options and I just want to, talk about scalp health and I don't want to do anything. So, and as a physician, my job is just to offer the treatment options and then to bring that to the patient, look at their medical problems and tell them what I think might be the best. And then for us to kind of, meet with what fits their lifestyle, what's possible, what's affordable, what can we actually do consistently. If you're somebody who has 3 jobs, that it's going to be really hard to hold that comb over your head. I know that because I can't hold it over my head multiple times per week. But so I love it. In my personal experience, it grows hair, not quite as much, of course, as oral minoxidil. In my mind, oral minoxidil grows is amazing, but more data is needed to substantiate that. That is my personal experience. But I'm comfortable with the FDA cleared laser devices in the United States. Very comfortable with those. But I would tell my patients, be wary of buying them randomly on the internet, where you don't know what light is being delivered to your home, if that light is safe, if that light is the correct wavelength. And the experts who discuss this on the stage from a scientific basis, many people will ask, well, what if I just do it every day, like 3 times a day? We don't really know, but it could be that too much of a good thing is not a good thing. So in my office, I typically have them use the device in the way it was cleared by the FDA.
And finally, because I know we won't get to all these kind of treatment options that are available, one of the other topics that comes up, and I'm not sure how often you may recommend or implement this into a complete treatment approach, is potentially PRP or platelet-rich plasma. Is that something that you feel like has a role? And when do you typically recommend it? And if you don't mind kind of briefly discussing it, because I know some of our patients are probably even wondering, and listeners out there like, well, what the heck is even PRP? I haven't even heard of that as a treatment option.
Okay, so platelet-rich plasma is when we draw a patient's blood, we spin it down, we inject what we believe to be the platelet-rich portion. And many people believe that in the platelets, there's these growth factors, and when we inject them, they could be stimulating the hair. The FDA has not approved this as a treatment option for hair loss. So it is definitely something that you have to talk about directly with your doctor to see if it's a fit for you. But I would say in the literature, it is very hot, it's trending, and it's gained a lot of data, especially the last 5 years in the United States. And so you'll find many, many dermatologists injecting PRP into the scalp. And I've seen good improvement in androgenetic alopecia. And I think a lot of the data, patients who are younger, patients who are women, earlier disease, probably going to respond a little bit better, but it's expensive, typically not covered by insurance. So that can be, an issue. And then it hurts to inject people. I'm always like, would you like a numbing cream? Would you like to wait for some ice? Would you like, a massager? Are you doing okay? It hurts. I mean, I'm a dermatologist. I remove skin things all the time, but every time I numb someone or poke them, we feel it with you guys. And I tell my patients honestly, like, it hurts. And another thing too is definitely get this done by a board certified dermatologist, because it is a blood product. So if you don't want to go somewhere where they could give you someone else's blood, where the products could have been switched around, like that would be a medical emergency, or you could have been exposed to, like an infection. You could get exposed to an infection, and then you never want to go somewhere where they cannot handle the complications of the procedure. Too much bleeding, pain, headache. And there's some other things with platelet plasma that are possible, but most people do great. So this is the sort of thing that involves a blood product. And I really encourage people not to go for the any sort of backdoor process with this one, because it's high risk to your health if it's not done in a very sanitary, clean way, and the maintenance of the device is not good and whatnot. So platelet-rich plasma sort of boomed just before oral minoxidil. So you've got people doing all this stuff now. And then there's all these offshoots now, platelet-rich fibrin, which I'm just gonna put that in not sure about category right now. And then regenerative medicine is booming in hair loss. And I will say in one plug, I have yet to be sold on this exosomes trend. I am concerned, and the FDA has not approved exosomes for injection for hair loss. So that is something I speak on routinely. And just like these hairceuticals, all of these things, it's important that patients and doctors demand the most data possible and the most regulatory input from the FDA so that we can be safe when we go shopping or when we go to a clinic. So the marketing is so powerful for some of these things, but when you look at the data, a lot of times it's evolving. It's not, and it's just not there. So I have never injected exosomes in a patient, and I'm not there yet with that whole exosome thing. And somebody asked me if they should get it at this point in time at the date of this podcast, I would say no. Medicine changes over time, but yeah, definitely talk with your doctor directly about that. So, are you a
But
fan of platelet-rich plasma too?
I have seen some good results with it. I think the dilemma, or the challenges that you just mentioned, it's costly. So that's probably my biggest obstacle, in trying to get some patients to do it and just, waiting to see those results, maybe having to do it obviously more than once. So it's the cost factor, I think, that adds up. But I definitely think there is a role for it. As you just kind of described in our conversation today, treating hair loss is so complex. I think what's, so optimistic is that the options that are on the horizon, we are making improvements in hair loss where I think for a long period of time, we didn't have much to offer. And not that it's still not challenging to treat, it is. So for anyone out there with hair loss, we understand as dermatologists, we get frustrated too, because we know this is difficult to treat no matter the type that you have, even if you have the more classic female or male thinning that we all get that sometimes happens over time. And for some of us, it's more severe than others. So it's been a great conversation to touch on things, just kind of looking beyond, minoxidil and the spectrum of what we just thought of that, okay, I've got Rogaine, that's all I've got. Because what you've heard today is that's not true. There are a lot of other options, and there are even more that we didn't dive into today that we'll definitely have to have you back on, Dr. Farah, to talk about that more, because I think this really has just opened the door for treatment options for patients. Like you said, you can go more aggressive or less aggressive depending upon sort of your mindset, as a patient, and just kind of how you want to approach it as well. For our listeners, if they want to try to find you, where can they locate you online? Where are you available? And can you give us a little tidbit on that, please?
Yes. So I'm in Minneapolis, Minnesota. I'm opening a new office called Illuma Dermatology. Right now, we're doing the demolition and the build. I have spent a decade at the University of Minnesota, very interested in hair loss, publishing on hair loss, speaking on hair loss. So I'm excited to really get to focus on my patient's experience. I'm excited because there'll be a hair transplantation room there. We've gotten the hair metrics device there where we're going to do hair counts for patients, global photography for hair. A lot of experts will do standardized global photography for hair loss and hair counts using something similar or called hair metrics. So I'm excited to be able to do a little bit more tailoring for the hair loss patients. And so they can look on Instagram, Dr. Ronda Farah. Ronda has no H, Farah has one R. And they can follow me there. If you just look up www.rondafarah.com, you'll find me there. And then for anyone listening who does have hair loss, I think one of the biggest concerns I see, I love social media. I love this podcast. I actually have worked in social media for our academy, is people will self-treat their hair loss, and they'll do it for years, and then they'll come in to see a dermatologist and they don't actually have androgenetic alopecia. They have a different disease the whole time. So if everything you guys took away from this podcast, I hope that you can just take away, there's a lot of treatment options. They can be tailored for you. The safety can sort of be weeded out for you specifically with a board certified dermatologist. Diagnosis is key. Don't let the marketing get too powerful, go in, get an opinion so you can sort through it, get the right diagnosis. Because today we're talking about medical information, not medical advice. Thank you so much. Okay.
Of course. Thank you so much for coming on the podcast. And stay tuned for the next episode of Derm-It Trotter. Don't swear about skincare.
Thanks for listening to Derm-It Trotter. For more about skincare, visit dermittrotter.com. Don't forget to subscribe, leave a review, and share this podcast with anyone who needs a little skincare sanity. Until next time, stay skin smart.